Tonight we're going to talk about the health of our community. These presenters will address the issues of illegal drugs, underage substance abuse, and prescription drug abuse. They'll also talk about the problems we face regarding mental health and substance abuse issues in our community, and they'll provide suggestions on how to address the issues and what we can all do to play a part in building a healthier community for all of us. Following the presentations, we have time for questions. We'll encourage your participation. With that, I'd like you to meet the presenters for tonight. From Minnesota Teen Challenge, Gina Evans, Community Outreach Director. Gina. From the Red Wing Police Department, we have three people here. Red Wing's Chief of Police, Roger Pullman, Adam Crane, Patrol Officer and Drug Recognition Expert, and the School Liaison Officer, Ryan Sullivan. From the Goodhue County Sheriff's Office, Jonathan Haneke, Investigator in Southeast Narcotics Task Force. From Hiawatha Valley Mental Health Services, Julie Hansen, Executive Director. From Red Wing High School, Cameron Voigt, he is the Red Wing High School Students Against Destructive Decisions President. Red Wing Chemical Health Advisory Parent Volunteer, Chris Blaney's here. And Julie Hatch, the Executive Director of Chemical Health Initiative of Goodhue County. And I'm Tom Hughes, your MC for tonight. First presenter for the night is Julie Hatch. She's the Executive Director of the Chemical Health Initiative of Goodhue County. She'll provide an overview of the Chemical Health Initiative and the work they do in communities to reduce youth substance use. Tongue twisters galore tonight.
All right. Good evening, and I thank everybody that came out on this beautiful night. I know that I'm sure all of us would have rather been out there enjoying our first wonderful weather that we are having here, so I do appreciate you all coming. We are recording this event to be played on Channel 6, so it is my hope that we'll have a lot more people that will be able to view it at that time. So, as Tom said, I'm Julie Hatch, and I'm the Executive Director of the Chemical Health Initiative, and I just want to give you a little bit of an overview as far as who we are and what it is that we do. There's some individuals that still don't, understand what are your goals and what it is that you want to do, but I just want to give you a little overview as far as when it is that we started and where we are right now. We actually started back in 2003. When the Goodhue County Youth Services Coalition did an audit and inventory, and at that time they partnered with the Goodhue County Family Services Collaborative, and they found that there was gaps in services, prevention, intervention, and education in regard to the chemical health area. So it was at that time that the Family Services Collaborative developed the Chemical Health Initiative. And so we started in 2004, and in 2005 we applied for a federal grant called the Drug-Free Communities Grant, and at that time we were able to receive those funds that we still have in place right now, which we will have for another year and a half. This is how our organization is set up. We have the Family Services Collaborative, we have our advisory board, we have a sustainability committee so that hopefully we'll be able to sustain our efforts after our federal funding is gone. And then we have our two staff, an executive director, that's myself, and then I also have an administrative assistant, Tara. And then we work within our CHI councils and chat teams in order to focus on our community sectors. The communities that we do serve in Goodhue County, we serve all communities within Goodhue County to include Pine Island. Our approach is that our solutions are within the community, and we believe and we know that working within each community, we're able to implement different policies, practices, and procedures in order to reduce youth substance use. How it is or what it is that we do, again, like we said, we work in the different communities, we work with the 12 sectors, so that, again, we can implement the policies, practices, and procedures. This is just a snapshot of the individuals and the volunteers that come to the table almost monthly so that we can organize our efforts within the communities and our school districts. And then we also have our advisory board. These are our local leaders who are able to help implement and strategize around what it is that we accomplish. We utilize a strategic prevention framework, and we utilize an evaluation process so that we can plan for what it is that we do within our communities. We provide, or we conduct countywide community survey. We do youth surveys. We also conduct youth focus groups, which actually are the favorite part of my job, when I could get to sit down and talk with the kids and figure out what it is that they think needs to be done and what they think the issues are. And then we also conduct key informant interviews. So it's through this process that we can determine what it is that we need to do in order to develop the strategic prevention framework. Environmental strategies, because we don't focus just on smaller groups of individuals, so those kids that or adults who just use heroin or methamphetamine. We really look at a whole community-wide approach so that we can educate all parts of our community. When we work on these community solutions with our environmental strategies, what we do is we really kind of work at it from that community level. An example of this is with our toddlers and our adolescents. As toddlers, we really put in place a lot of these environmental items so that kids don't harm themselves. So we put protectors over the outlets, although sometimes that doesn't work with little boys, even when they get older. But we certainly try to implement and put things in place to protect our toddlers. But that's not always the case with our adolescents. They still need that direction, and they still need those protective factors within their communities as well, so they're not texting and driving. A lot of times what we'll do is we will implement policies or ordinances or laws that help protect these kids so they'll get pulled over if they are caught texting and driving. Again, it's more of a protective factor for them than anything. I just saw for the first time last night a commercial about texting and driving, and the law enforcement officer at the end, because it was a group of kids in a car, the driver picked up her phone to check a text message really quick, and they were broadsided by a semi. And at the end of the commercial, the law enforcement guy comes on and he says, "I will ticket your child if they are texting and driving, and this is why." So again, it's just those things that we want to make sure that we're protecting our kids, but a lot of times we don't protect them as though like we do when they're adolescents. So again, we put in place ordinances and laws so that we can work on those environmental strategies to address those issues. If you received a program for tonight, we do have a little bit of a change. We're actually moving Gina and her daughter a little further down the line, so she's going to actually talk before Cameron. And I'm just going to go right into the youth substance use data. And I'm sure a lot of you kind of feel like this guy up here in the cartoon. Kind of get that glazed over look and trying to figure out, okay, what does all this data mean? And so don't have an awful lot here for you. I'm a little bit of a data geek myself, and I could probably go on, but I just want to touch on some of the data points that we do have here available. These are results from our 2013 Minnesota Student Survey. Some of the things that you'll see here is normally we're able to give trending data for our youth from this Minnesota Student Survey. This last year for the 2000 survey, they changed an awful lot. And so they knew that they were going to be making a lot of changes, so they decided to do them all at one time. So they actually went from surveying grades 6, 9, and 12, and now they're surveying grades 5, 8, 9, and 11. So really any trend data that we had before is gone. So really right now this is our baseline, this is where we're working from, and so we really don't have any comparisons. We will be showing you Red Wing data in comparison to the Goodhue County data, however. This is our past 30-day use. This is our 6th graders, 9th graders, and 11th graders. Please note that you will see we don't have the lighter blue for the 9th grade, and this is our Red Wing data. Red Wing decided not to have their 9th graders participate in that particular survey year, so you'll see some gaps there. But what we're seeing here is the past 30-day alcohol use. Red Wing is marking lower than our 8th graders in addition to our 11th graders. But do keep in mind that this is past 30-day use. We had 6% of 11th graders, and we have 20.5. So we have a fifth of our 11th graders, which are now our seniors, that drank in the last 30 days. In addition to our marijuana use, we again have our Red Wing data in comparison to our Goodhue County data, and you will see that with marijuana use, we do have an increased amount for our Red Wing students in comparison to our Goodhue County students. This particular data I tend to keep an eye on a little bit more, especially with the marijuana. There's a lot of marijuana legalization going on, especially in the state of Minnesota right now, as that's still at the legislative level. But as soon as states start to legalize it, even medicinally or recreationally, what happens is that we're sending kids a different message saying, you know what, this substance is actually okay. Whereas research will show that there's a lot of conflicting information with that. So once kids hear that and they see that it is being legalized in different states, the percentage of that marijuana use tends to have an uptick. So we will continue to keep an eye on this one and hope that we can still implement some prevention efforts in order to make sure that we aren't seeing those increases like other states have. Prescription drug use, not prescribed to use, so this is prescription drug misuse and abuse. These are kids that are taking someone else's prescribed medications. I know that our Red Wing Police Department as well as John Haneke are going to be talking about heroin, methamphetamine, and this certainly ties into that. And so I wanted to make sure that we were providing you some information on this as well. Again, you'll see here that we do have more use in the Red Wing level than we do at the Goodhue County countywide level. So again, certainly something for us to work on, as this is a constant. We're continually having to work on prevention in all areas. Heroin, I wanted to provide this data even though it's very small. And our law enforcement officials here will be talking a little bit more about that. So our 8th grade level, we have 2% in the Red Wing School District. This is one person. Goodhue County, we have 1%. This is 2 people. So please note that even though we have use, which is unfortunate, these percentages are very low, and we hope that they stay low like that. Meth use, again, lower percentages, but again, something that we want to keep an eye on, and we'll tie that into what the other presenters have here tonight. Youth perception. Youth perception plays in an awful lot in regard to if kids choose to use or not. And this looks like an awful lot of data. If I were sitting in your seats right now, I'd be glazed over right now going, what on earth are you putting up here? Key things that I want you to look at right now. We have perceived risk of harm. So these are the percentages of students that have said that this is a great risk or a moderate risk if they were to use these substances. So we have smoke 2 or more packs of cigarettes a day, drink 5 or more alcoholic beverages once or twice a week, smoke marijuana once or twice a week, and use prescription drugs not prescribed to you. What I want you to look at on here is definitely the data as far as percentage-wise, but this is an important part here. If you take a look at our 5th graders and the percentages here, fewer 5th graders are finding these substances to be moderately or great harm to them. As they get older, once they start receiving more health education in the schools, those numbers increase. So it's important to know that if our kids, our 5th graders, are looking at these substances to be less harmful as the older children, then we certainly need to take a look at is, you know what, we maybe need to start educating our kids at a younger age. And research right now is stating that we need to start that at even in the 3rd grade level. So this is what I wanted you to walk away from in regard to this data here. So again, I'll talk a little bit as far as what it is that we're doing within the school districts and the communities in a minute, and a little bit here to show you what it is that we are working on there in regard to that. This is the first year that the Minnesota Student Survey has actually asked these particular questions. So it's the perceived versus actual. So this is the number of students. Parents and other adults should clearly communicate with their children the importance of not using alcohol. So these are the kids who reported that they agree or strongly agree with this statement. So we have 81.5% of our 8th graders and 80% of our 11th graders that are saying parents and other adults should clearly communicate this. We have a large number of students here, of kids this is just Red Wing data, that are saying, yeah, we feel that this is something that our parents and other adults should be doing. But when we ask them, how many of your peers do you think feel the same? And they're really perceiving that to be a lower amount or a lower percentage. So certainly take a look at our kids and how they react to different things, and the choices that they make has a lot more to do with this percentage than the actual percentage. I have another example of this. This question was again asked of them. Drinking alcohol is never a good thing for anyone my age to do. Again, these are students who reported that they agree or strongly agree with this statement. Again, here's our actual with our 8th and 11th graders, but here's that perceived, how they feel that their peers would respond to that, and they feel as though less numbers of their peers would agree with what they had just stated. Another example of that perceived versus actual is the reported use versus the perception of others' use. Now, before we go into these two graphs here, actually 3 of them, the percentages that are listed on here are the kids who have not used, who have reported never using these substances. So, with our 8th graders, this is the actual number of students who have reported that they have never used tobacco, whether it's cigarettes or chews. 11th graders, but then when we ask them, what's your perceived amount what's the number of students that you think have never used? So this is the perception. And again, they're looking at 33%. So now we've got these huge differences. And we know that there is a direct correlation between if they perceive other youth are using, direct correlation in whether or not they choose to use them as well. The exact same thing here. 87, but they're thinking that only 16.5% of their peers have never used before. That's tobacco. Here's alcohol. We're seeing the exact same thing. Same thing with marijuana here too. So again, it's certainly something for us to know, and this is great information for the kids to know. This is information that we need to get to them to say, you know what? Not all of you are doing what you think you are, and we should be lauding this particular number and saying, you know what? This is not reality. So changing those attitudes with the kids in addition to changing the attitudes with the adults as well. So promised you I wouldn't give you too much data. I know I'm seeing heads nod already, but I'm going to turn it over to Roger, Ryan, and Adam. They're going to be talking about what they are seeing in Red Wing in regard from the law enforcement perspective, and I know Roger's also going to be talking about different things that they will be implementing and the different drugs that they are also seeing here too. Okay.
Okay, thank you for coming this evening. And, you know, just to piggyback a little bit on what Julie said, at one of our chemical health initiative meetings for the city of Red Wing, we were talking about statistics and numbers. And one thing that jumped out at me was in 2012, it was just approximately a little over 90% of the students surveyed had felt that their parents would be upset or concerned if their children were using drugs or a controlled substance. And then later, in 2013, when they did the survey again, that number had fallen 10%. It was down into just over the 80% that the parents or the students felt that their parents would be concerned. So that kind of told me that we needed to do a little more education in our community on the true effects of drugs so that parents realize that it's not okay and we can't just let them experiment, because these things do cause serious damage. At the end of the month, I'm going to be coming out with our annual report for the Red Wing Police Department. But I had some initial numbers for what we were seeing in 2013. For narcotic offenses reported in the city of Red Wing, we had 109. Narcotic arrests, Narcotic arrests in 2012, we had 180. In 2013, we had 240 narcotic arrests. And part of that is because of the efforts that my officers are putting into looking for those violators and offenders. I have one officer that is assigned to the Southeast Minnesota Task Force, which is made up of 9 counties and 4 cities, of which Red Wing is one. And we've also tried to put a lot more emphasis on arresting those personnel involved in drug trafficking and activity. Some of the other numbers I pulled out of our stats are what I call kind of collateral damage or related to the drug trade. Burglaries, we had 69 last year. That's more than one a week. Larceny thefts, this could be shoplifting, stealing something out of a locker, any kind of theft, 456. That's over one a day. Vandalism, damage to property, was 167. DUIs, driving under the influence. Now this can be alcohol or it could be under the influence of a controlled or prescription drug. We had 101. Liquor law violations. That could be an open bottle, underage drinking, or anything under the liquor laws. We had 29. Fraud reports. Somebody using somebody else's identity to try to purchase a prescription drug or try to get cash to help support their habits. We had 85 fraud reports. And forgery and counterfeit, we had 26 reports of those. Now, in a little bit too, I'll talk about the increase we're seeing in town as far as heroin. And I know one of the papers yesterday had a great article in there about heroin use in the area. And one of those sad numbers that kind of go along with the heroin and the drug usage, in 2013, the Red Wing Police Department responded to 76 attempted suicides. That's more than one a week. That's, for a town our size, is not acceptable. We had 4 successful suicides where the person did not make it. To go into a little more detail, as far as trends on drugs that we're seeing in town, I asked my task force officer what they were seeing and some of the activity going on. Acid, LSD, multiple sources have started reporting that is available in town again, and it's also available to high school students within our community. Marijuana, as we know, the medicinal marijuana movement that's crossing the nation is causing a lot of people to start to not look at it as a serious problem. But there's something important that we need to realize, and that is in 1975, the strength of marijuana with THC levels was right at about 3%, 3.5% potency. The marijuana that they're getting today is about 8.7, almost 9% potency. So it's twice as powerful as what it was when a lot of us were youngsters. One thing we're also seeing is that people are getting more creative. Earlier in 2013, we created a drug bust and a raid on a home that had a device that looked like a pipe bomb. It was about 3 inches round, about a foot long, had tubes coming out the end. And what we found out was that it was an extraction device for pulling butane hash oil out of marijuana. Now, when they pull the hash oil out of marijuana, then that can be mixed with other things into a candy form or other types of forms. But the THC level in that hash oil is about 40 to 70% range. So if you're thinking about marijuana at an 8.79% potency range, that hash oil is 40 to 70% potency. Prescription pills continue to be a concern. We do have a prescription drop box at the law enforcement center that's available 24 hours a day. You can just take expired or if your prescription drugs are no longer needed, take them to the law enforcement center and drop them off. One thing that we're seeing a lot of thefts and sales on is on the prescription drug of Adderall. And those pills are easily accessible to a lot of young people, and we're seeing them being sold also on the street. A few years back, the drug was Oxycontin. We're not seeing a lot of that anymore nowadays. However, we believe some of that is because of heroin appearing on the street at a much cheaper level. So a lot of the people that were taking heroin or Oxycontin previously are now switching over to more heroin. And that leads us into the next drug that my task force officer identified, and that is the heroin. Is definitely more prevalent in our community. Talking to users and addicts in the area, they're saying that it is so potent that just one try and they're becoming addicted. So it's not something that they think they can try and they'll be okay, they don't have to touch it again. We're finding that a lot of them are telling my officers that they tried it once and they became addicted almost instantly. So again, this is a great concern. One thing that from January 1st, 2014 to date, or the past 15 months, January 1st, 2013 to today, we have had 5 heroin-related overdoses. Now, the heroin, that means they were either previously addicted to it or it was in the vicinity of where the overdose occurred. And the victims did not die but were brought back by paramedics in the hospital, but all were very close to death. So again, heroin is a type of a depressant, lowers your body, slows it down, and we are seeing that used in some of the attempted suicides and suicides in our community. In that same period, 3 of the deaths involved young adults between the ages of 16 to 23. So again, something that we need to really take seriously in our community. You may hear that there's a movement to see if officers can carry a drug to counter the effects of heroin. I think it's called Narcan. One thing, though, that if that is available or approved for officers to carry, as Adam Crane pointed out, my drug recognition expert, that will require an EMT certification because it is a controlled substance. Another very prevalent drug in town that we're seeing a lot of addiction to is methamphetamine. However, right now that is not showing up in the teenage level age. Synthetic drugs are in town. One thing to remember, when they make a synthetic drug, they may take like a leafy substance and then spray it with this chemical compound that they mix up. What people are failing to realize is that the spray concentrates on the top level of the leafy substance. So therefore, when they try the synthetic drug, if they take the leafy substance from down further in their batch, they may not have as a severe effect, and they may think they need more. So then the next time they try it, they may try to double what they're using, and if they get into that top level, since there is no consistency with it, they're having a much adverse reaction. One thing that we're seeing with synthetic drug use is a very erratic behavior. The user will become extremely overheated. Most of the time they will disrobe. We had one incident last November when it was, it was below freezing. One of my officers picked up an individual walking on East 7th Street out by the Armory in basically nothing but a pair of socks and his boxer shorts, and he was having a reaction to synthetic drugs. He was later taken to a detox, and I found out later that he was transferred to a Minneapolis St. Paul hospital for treatment and recovery on that. So he was very fortunate. But again, the damage is done, and it's not something that we like to see. Ecstasy, and another name for it, Molly. We hear about this occasionally, but we are not seeing it in our confiscations or our raids. Cocaine and crack, again, very similar. We hear that it is in town, but again, we're just not seeing it to the levels that we see the marijuana, meth, and heroin. And then one last area that I want to point out is we are seeing a lot of what is called lean in the community. Lean is basically created by using Sprite soda, could be any variation of Sprite soda as long as it's not the diet, Jolly Ranchers, and also a cough medicine that contains a codeine. They mix this up together, pour it in, say, Gatorade bottles or anything. To the casual observer, you may not even realize that they are participating or taking a controlled substance, and they're walking around drinking that. It originated out of Houston, Texas, and again is primarily made with Sprite, codeine cough syrup, and Jolly Ranchers. So with that, I guess the last thing I'd just like to point out is that we realize that these are some serious trends. There's some concerns in our community. And one thing I believe strongly in is that any best practices to counter this type of activity would have to consist of education and enforcement. The first level of education is, of course, public forums like this to let you know what's in our community, because otherwise some of us may never really know what's out there and think things are great. But by educating, first of all, the public in our community, and then also working with our schools. I'm working with our middle schools and our elementary schools currently to bring in a program that will teach better decision-making skills. It teaches our young people how to set goals, and then it doesn't tell them what they should do, but it provides them a process that they can implement to make good decisions that'll fit their life. So we want to enhance that education on decision-making skills and help our young people make proper choices. So as they're exposed to these things, they don't say yes, and they can do the right thing and keep their life on track. The other side of it is our enforcement efforts. With the potential for medicinal marijuana and other activities in the area, this past spring, we had 2 more officers attend a drug recognition expert training at White Bear Lake, taught by the Minnesota State Patrol. And that will help us identify people that are under the influence of a controlled substance. In the past, we always used to train people on DWI enforcement, which might deal with alcohol. And that always dealt with the odor of alcoholic beverage. Or if you made a marijuana stop, you could always smell the marijuana in there. Well, with the prescription drugs and a lot of the controlled substances that are out there nowadays, you don't have that odor. So it's very important that my officers have the ability to recognize those symptoms that may be displayed by an individual so that we can get them the proper treatment or keep our streets safe. So with that, I believe Officer Sullivan, my school liaison officer, wanted to just say a few words on his activities here at Red Wing High.
Thank you, Chief. Again, my name is Ryan Sullivan. I'm the Juvenile Liaison Officer here for the Red Wing Police Department and ISD 256. My role at the school has multiple facets. Like he said, I'm in an education and enforcement role. I act as a liaison between the police department and the school district, and I also act as a liaison between the school district, the police department, and parents. And that's one of the things that I get most out of the job, is being able to communicate with parents, answer questions, and just be another resource that they have in their pocket or in their phone that they can call and ask questions to. In terms of the state of drugs and alcohol, tobacco in the Red Wing High School and middle school, which is where I predominantly work, I'm proud to say that since I've come here in December, there hasn't been a single instance of a possession of drugs or alcohol in the school. Some of the concerns that I'm hearing from students and just word of mouth is prescription pills, like he had mentioned. There's a major link between opiate prescription use and abuse and heroin use. It's a very slippery slope. People tend to get on these pills and they take them for fun. They get addicted to them. Buying the pills in the black market is more expensive than it is to buy heroin, and that's how they end up in those pits of despair that he had mentioned. Another thing is the ADHD medications. They fall in line with amphetamines, the same as meth if you think of uppers like that. Some of them are Adderall, Concerta, and Ritalin. They're still being used by many students in the high school, and they're also being abused by others. I think one reason why this is more prevalent in the middle school and the high school is that this classification of drug is tended to be prescribed to the youth who are diagnosed with ADHD. Some of them want to take it, some of them don't. But I'm actually hearing reports that entire month prescription bottles are being sold to other students who are drug dealers for $5 a pill, and that's at the base level. If you think about that, for 30 pills, that's $150 for a month's supply. So I'd ask that parents who have kids that are diagnosed with ADHD or other disorders that require to have those medications, keep a good eye on your child's prescription level and understand that a month supply should last 30 days. I wouldn't give it to them to take to their locker because you really never know. And something else that Investigator Haneke will touch on, sales of those pills is a felony. That's what happens. It's no different than selling meth or crack or heroin on the street. One pill is considered a felony based on the schedule level. So a simple thing parents can do is to keep an eye on the pills. They can keep their kids from doing something by being pressured into it or needing money for something. Another thing that the chief touched on that I'm hearing a lot about is the codeine, cough syrup, and lean. It seems to be popular in the high school era and early college era because it's on music videos. Rappers are talking about it. Celebrities post on the internet about it. I'm not sure why that culture has made that an acceptable thing to do, but it tends to be something that the youth will grab onto and see that these people are doing it and it's cool. And whether or not they're actually using the drug, they're talking about it. That kind of creates an overall culture of acceptability, and that's really not something we're going for. So if you hear people talking about lean or hear your kids see it on Facebook, if they talk about it, let them know, hey, that's not okay, that's not right. We're not going to put up with that. Tobacco incidents here at the school, I'm proud to say that they're few and far between. In terms of actual cigarette use and chewing tobacco use, they're fairly low. What is on the rise is e-cigarettes. Many people have seen them. They're smokeless tobacco delivery devices. It's now against the law for a juvenile or a minor to possess a nicotine delivery device. It's no different than being in possession of tobacco or chewing tobacco. It's now also against the law to sell one to a minor, so it puts a little bit more of the burden of responsibility onto the stores that sell these things, whether it be a tobacco shop or your everyday gas station or grocery store. In terms of alcohol, I'm hearing reported use on the weekends. People talk about it. There has not been, in my time here yet, one reported use of alcohol at a school event or at school, which is saying something big because for the Red Wing High School athletics, where you tend to have these problems, we have girls that went to section finals, boys that went to section finals. We had a girls hockey team that went to state. These are big events where people will tend to make silly decisions, and our kids have done a good job by making the city of Red Wing proud and acting like the responsible young adults that they are. Some of the things that I do and we do at the police department to work on the enforcement prong of keeping our kids safe and keeping the alcohol, tobacco, and drugs out of their hands are when people are having drinking parties, our patrol division is doing a great job of following up on leads and following up on complaints. These young adults are being caught, cited. Their parents are being notified and schools are being notified about them. And another thing the Red Wing Police Department is proud to say is we're strongly enforcing the social host ordinance. I'd suggest you take a moment and look that up on the internet. Long story short, if you're hosting the party or where the residence is being held, even if it's a hotel room or a residence or an apartment, there's a statute that says that's against the law to host a party where minors are drinking. We're also strongly working towards charging out people that are furnishing and providing alcohol for minors. It's surprising the number of people who are in the 21 to 25-year-old range that don't think it's a big deal to pick a case of beer up for a 16, 17, 18, or 19-year-old. It's against the law. It's actually a gross misdemeanor. Right now, the CHI, with prom right around the corner, they're working on something called Those Who Host Lose the Most. And it's basically a flyer campaign that we're going to be putting signs all over, street signs in yards and things like that, just to let people know that being the host of a party where alcohol is involved is a problem. It's a legal concern, and there's a lot of liability on you. We're trying to spread the word that it's not okay for that to happen. Another thing that we do is we do compliance checks at alcohol sales locations and tobacco sales locations. We do these as often as we can. We don't do it on any set schedule because it's like anything, we want to keep the sellers on their toes as well. If we told them it's going to happen in the month of April, they'll be good for 1 month, and who knows what they're going to do the next 11 months. I don't really have too much else. I just wanted to say that I'm here if you have any questions, especially for parents. I work at the high school here predominantly, but I'm also at the middle school. If you need to get a hold of me, you can call the school during school hours, or if it's after hours, you can contact the Goodhue County Dispatch, and I'm more than happy to answer any questions you have. Thank you. I better introduce the next guy here. This is Adam Crane. He's a drug recognition expert.
All right, listening to Ryan and Roger speak, I just wanted to touch on a couple things. First off, my main role for being here is if you guys have questions about what to look for in some of these drugs with a kid, go ahead and ask me. I'll try to answer it the best I can. Again, I'm new. I was one of the 2 that he sent this spring, and I should be capable of answering it. 2 things I wanted to touch on. One was inhalants. Nobody's talked about those, but they're prevalent, and the reason why they don't get talked about is because their use can be hidden. Inhalants would include things like dust off, certain spray paints, especially gold, and rubber cement. Kids will use those they'll sniff them and get high, and sometimes those highs can lead to an instant death if they don't get into a area of fresh air right away. And another thing is with the e-cigarettes, those are bad news for law enforcement especially, because not only are people using them for tobacco, but they're also going to start using them for meth, marijuana, heroin. You can use them for a drug that's called dabbing. Basically, Chief Pullman talked about the butane hash oil. That hash oil can turn to wax, and you just take a pin prick of that wax, and you put it in an e-cigarette, and that's just like getting high with marijuana, except it's more potent and your high will last longer. So that's all I wanted to add. If anybody's got any questions, again, I'm here and I'll try to answer them the best I can. And John will be coming up to talk.
Hi, I'm John Hunnicky. I'm with the Goodhue County Sheriff's Office in Southeastern Minnesota Narcotics Task Force. A lot of the trends I've kind of covered here in Red Wing, we also see in the county and Southeastern Minnesota. Our task force is about 7-8 counties, major areas like Rochester, Winona. We're seeing pretty much meth is still our #1 drug out there. That's what we kind of, and our task force kind of targets the dealers, the bigger people. But still meth is our #1 drug out there. Heroin's made a very big increase here over the last several years. It's only going to continue to be, you're going to see a bigger use or bigger increase in those amount of users. The heroin's probably public enemy #1 if you want to look at it just for the fact of their overdose deaths we're going to see, and that's only going to continue to increase. Someone had touched on it earlier, seeing a lot more of just your younger people, the 15 to 30-year-old group. We're not seeing probably maybe as many new meth users. We're definitely seeing the heroin users. Goodhue County even sees, not like our individual users, but the drugs are coming out of the metro is what we're seeing a lot of. So we'll get the people from Rochester driving all the way to the metro to get their heroin. We can get them overdosing in our county. We've had it happen at McDonald's. We've had it happen all over. So we're definitely seeing the increase in overdoses. Not all of them are fatal. What we don't actually know is the actual number of overdoses we're having go on. Just with HIPAA, some of those type things, we're not going to ever have accurate numbers and how it is. So the only ones we know about are the ones where law enforcement gets notified. If someone is overdosing, they take that person to the hospital, the emergency room, we never know. So the actual number of overdoses is probably way higher than we're ever going to know. But it's just going to be one of those emerging trends we see. Some of what we are seeing, they had touched on, there's states like Colorado that have now legalize marijuana. With the internet now, with cell phones, and with shipping methods as they are, there are people can call up somebody in Colorado. Next thing you know, we're getting multi-pounds of marijuana shipped through FedEx, UPS, you name it, they're shipping it in. We catch a fair amount of it, but there's a lot being delivered that way. So marijuana that's being smoked or used in the Goodhue County area, even southeastern Rochester, could be California weed, it could be from Washington, Oregon, Colorado. There was a traffic stop not that long ago where a kid just drove a car out there, filled up his car with marijuana, drove back, he got stopped. We're going to continue to see that. With the internet, they've shut down one site. In our task force area, we had stuff that was getting shipped from China. The bath salt, some of the synthetics, methamphetamine. With the internet, how it is now, pretty much anything can be found. So we're just seeing a lot of that type of stuff. Most of the other stuff was pretty well covered by everybody else who's presented here thus far. As far as we go for investigations within the Southeastern Task Force, we concentrate on dealers. Sometimes to get to the dealers, we are going after maybe users or the smaller people. But that is our primary goal, is to go after the bigger dealers so we can have a bigger impact. But as far as our drug investigations go, if you have a neighbor that you suspect of doing something, you can always call local law enforcement, let us know. Some of our best cases have started from tips from neighbors who just notice strange activity. Sometimes the strange activity might be that your neighbor's outside burning stuff late hours of the night. Well, what we tend to find in most cases is the people that are using narcotics are also stealing. If it's methamphetamine, we see a lot of the scrapping where they're stealing copper or whatever else it might be. So if you see strange stuff, report it. If you have a child, I recommend everybody go through your kid's cell phone once in a while, and you might be surprised what you find. When they talk about this prescription pills, if your kids say prescribed Adderall, it won't hurt just to go through text messages, emails, whatever it might be, to see what they're up to. I know there's a lot of parents that don't go through it, and when they finally do, they're quite surprised what they find. In the end, if you're paying the cell phone bill, it's your cell phone, check it. Maybe you don't have kids, but you maybe know someone with kids, ask them if they check their text messages once in a while. There's just a lot of stuff you're going to find out that you would have never had an idea about. With the thefts, I don't know what the exact numbers are, but I bet 75% to 80% of our thefts, when they happen within the county, they're narcotics related, usually a user. Methamphetamine's not cheap, heroin's not cheap. Some of our heroin users are using anywhere from, they might have to use every 4 hours, some are every 8 hours, depending how addicted they are. It's not cheap. Methamphetamine, just to get a use amount maybe in a week, could cost you anywhere from $150 to $200 a week. Well, if you don't have a job, you're getting it somehow. So that's where we take the thefts, we go after thefts and go after them aggressively, because we know that's a lot of times going to get us to some of our narcotics users. So I think that's pretty much everything I have.
Our next presenter comes to us from Minnesota Teen Challenge. Gina Evans will talk about her life experiences and struggles with drug addiction. Joining her is her daughter, Danielle Conley.
Good evening, everyone. Thanks for coming out tonight. My name is Gina Evans, and I am the Community Outreach Director at Minnesota Adult and Teen Challenge. And so Teen Challenge is a drug and alcohol treatment program for teens and adults. We currently have 600 treatment beds in the state of Minnesota, which makes us not only one of the largest treatment programs in the state, but also one of the largest treatment programs in the country. And all of the stuff that the officers and Julia's been talking about tonight, we see in real life, in real time, every day. One of the things that is the hardest thing for me to see, I go into the jails and into the prisons and meet with inmates to talk about treatment as an option for them, either instead of going to jail or prison, or after they get done with their sentence. And the one thing that I see often these days that breaks my heart is these young 16 to 25-year-old middle-class kids. And I can walk into a jail cell with a group of 8 or 10 people and pick out the one that's in there for heroin. And it's so sad. They get so sick from it. And when the chief talked about public enemy number one, I couldn't agree with him more, because there's no other drug out there that somebody who doesn't have it and can't use it is going to get physically sick. Heroin addicts will do anything to get the drugs that they need so that they don't feel sick anymore, so they're not vomiting. And from what I understand, heroin withdrawals is just like having the worst flu that you've ever had. And so even more than meth addicts, they'll do just about anything they can to not be sick like that. We're seeing more and more of it at Teen Challenge, and we have a pretty good spread across the state. Minneapolis, we have programs for men and women. We have a men's program in Duluth, Brainerd, and then now also Rochester. We have a 100-bed facility we just started down in Rochester. And so we see a lot of methamphetamine and heroin addicts coming into our long-term program. Minnesota Adult and Teen Challenge is unique in that we offer long-term treatment. So for a lot of our men and women and teen boys and girls that are in our program, they're actually there for 13 to 15 months, which is a pretty long time in treatment. One of my jobs at Teen Challenge is to do community forums like this. We do trainings with parents about what to look for in a kid that's in trouble. Some of the stuff the officers talked about: medication missing, a kid who is in sports and doesn't want to go anymore, a kid that normally gets good grades and isn't any longer, kids that just are no longer interested in the life that they've been living up to then. Kids that when they get their driver's license, as parents, we need to be paying a little closer attention. There's a lot of things as parents that we can do, checking cell phones, doing some of that kind of stuff. I figure it's my job as a parent to give my kid every good reason to make good decisions. And if that good reason is I have to give my mom a hug and a kiss when I get home at night so I can't drink or do that, that's my job, is to give them a good reason to say no. I met Julie like 7 years ago. Teen Challenge hired me on to start their high school drug and alcohol prevention program. It's called Know the Truth. And we go into the schools, middle schools and high schools across the state, and talk with high school and junior high school students. The first year that I developed the program, we saw about, I don't know, maybe 12,000 high school and junior high school kids, which I thought was phenomenal. This year, my prevention team saw 52,000 high school and junior high school students. We do presentations in auditoriums like this during prom week. We do presentations in health classes, which is the place that I feel like it's the most effective. We go in during chemical health week. We don't bring anything extra to what the teachers are already teaching. We just add to it. We just add evidence to it. We bring clients that are receiving treatment services with us to talk about their experiences and how they thought smoking a little bit of weed on the weekend wasn't a big deal, and now they're in a year-long treatment program. Or they thought taking a couple Oxycontins that somebody gave them at a party on a Saturday night wasn't going to be a big deal, and they ended up in the hospital. And so what we do is just add evidence to what the teachers are already teaching, talking about gateway drugs and heredity and all of that stuff. And so we run a pretty successful prevention program, I think, and we do our best to put ourselves out of a job, is kind of what I figure. We're doing prevention on one end, and then when they need the help later on down the line. I don't know if you can tell or not, but I'm pretty passionate about what I do, explaining to people and helping people to understand that treatment is an option for them and that it can help. And the reason that I am as passionate about it as I am is because I was an IV meth addict for 15 years. The first time I stuck a needle in my arm, I was 15 years old. And I started with cocaine and methamphetamines. I grew up in Forest Lake. That was the beginning of a really long road for me. I have 12 felony convictions. I've been to Shakopee Women's Prison 3 different times. I have 2 beautiful children. My daughter Danielle will be 21 this month, and my son Christopher turned 14 last month. And my children were dragged through that lifestyle with me, going places and living places and being just a victim of my circumstances, of my decision. My family was ripped apart because of my decisions to use drugs and alcohol. been through 5 other treatment programs before I came to Teen Challenge. I did 21 months in Shakopee Women's Prison on a counterfeiting charge and possession of drugs, a third-degree possession of drugs. And when I got out of prison the last time, I made the best decision of my life, and that was to go to Teen Challenge for 13 months. 13 months seemed like a really long time, but it took me 15 years to make the mess of my life that I did. And so what's 13 months to get it straightened out? And it was hands down the hardest 13 months of my life. I lost custody of my kids. My mom put them up for adoption, and that's a whole nother long story. But that was what the circumstance that really made me turn it around and do something different with my life. My kids, after being at that adoptive home for 11 months, the parents decided that they didn't want to be parents, and my kids went back home to live with my mom and dad, and that was just, I knew that it was the place that God had for me to start over and do my life again. I think that what we're seeing right now is a generation of grandparents that are raising their grandkids. Not just a fatherless generation, but a parentless generation that are being raised by aging grandparents. And we need to, as an industry, do everything that we can to fix it. As a community, we need to do every single thing that we can to fix that. Kids need dads. Kids need moms. And we need to help those people get the help that they need so they can be parents to their kids. I wound up in Teen Challenge lost and broken with absolutely no direction. And I know there's some people here that are going to talk about mental illness and mental health issues. And the one thing that I received at Teen Challenge that I didn't get in any of those other treatment programs was that they dealt not only with my chemical dependency issues, but my mental health issues and my criminal thinking. All 3 legs of that table were finally dealt with in my life in a way that made it so that I could move on with my life. That cognitive thinking piece, I think, is so important, and I think sometimes as an industry we miss it, even with kids. Treatment changed my life, and it has the ability in the corrections industry, in supervision, in the schools, to help people get on a different track. We have become, whether it be mental illness or chemical dependency, a nation that just throws people away because of bad decisions or because of criminal behavior. And I just am a firm believer that if we deal with people's mental health and chemical dependency, that we can get our communities healthy again. We can get our family healthy again. So thank you guys. It really is impressive to me that you guys would come out in the beautiful weather and spend time tonight to learn more about your families or your communities and what you can do to change things. So I brought my daughter with. Julie asked about just like the impact on families with addiction and treatment and all of that, and I can't think of anybody that has a better story to tell than Danielle.
Thank you. She took most of my story by telling it already, I guess. The piece that I really like to talk about is that at the end, I'm a little bit taller than you, at the end of my 3rd grade year, we were going to get adopted, and we moved up with the family for 11 months, and then like the week before Mother's Day, they decided that they just didn't want to be parents or couldn't be parents. I still don't really know what their logic was, but so we got shipped back down to my grandma's house, and just like 3 or 4 weeks later, I saw a box by the recycling that had my maiden name on it, and I asked my grandma, is Mom coming home? And she's like, no, but she's going somewhere where she can get better. And it turned out that was Teen Challenge, and I didn't know about God or know about treatment or know about recovery, really, because I hadn't seen any of it. So it was just really interesting to have, just in that one moment over those next 13 months, to just have my life flipped upside down and to get my mom back after all that time. I just couldn't even imagine my life now, because she is my best friend, and she was the maid of honor in my wedding, and she was in the delivery room when my son was born, and I would have such a different life if she hadn't come back into it. I have a girlfriend at church who just turned 31, and she has 3 kids, and her mom is struggling with addiction, and she's not in any of their lives, and she wasn't in the state when any of her kids were born, and it just breaks my heart to have her still be dealing with that, and to have me have everything back together, to have my life back. It's just so nice. I couldn't imagine it any other way. So to try to think back to how broken it was, and to be parentless, because my dad wasn't around, because he just wasn't, and my mom was in and out of everything. It was a total life turnaround. So that's what I got.
And we'll be here afterwards if anybody has any questions about Teen Challenge or about families or whatever. Thanks for inviting us, Julie.
Our next presenter is Cameron Voigt. He's a Red Wing High School senior and Students Against Destructive Decisions president. And he'll talk about substance abuse and use from youth perspective by addressing a whole bunch of different issues. Cameron?
Good evening. My name is Cameron Voigt. As he said, I'm going to be talking about substance abuse on youth and what parents can do to help their kids and how to surround yourself with good friends and stuff like that. Communicating with your child isn't as hard as it seems it would be. My parents have always talked to me very well, have asked me what's going on these days, just small talk. It gets your kid thinking that all these things aren't as bad as what, or as good as what they seem to be from what friends are saying. And just talking to them will do a lot. It helped me, I'd say, by them telling me, oh, you've got really good friends, just keep hanging out with them and you'll go places in life. They've always tried setting goals for me and telling me to, oh, college is coming up, you gotta stay clear of all this stuff and just wait. It's not worth losing something that is meaningful to yourself, such as an education and a possible scholarship somewhere, either academically or athletically, by using a substance. Secondly, the youth can also communicate with their parents by saying, oh, like, I don't know what to do here. I got asked to go to a party. What should I do? Do I go? Do I not go? Just things like that. From keep using or not from using, I've always surrounded myself with good friends, good family. It's helped me a lot with a lot of my friends. They have the same mindset as myself, that using is not worth it and that there's better things to do. Like, for us, a fun Saturday night is hanging out in the basement, watching a movie, playing knee hockey. It's not as bad as it seems, but it's a lot of fun to us. I'd say the kids can also start the conversation. Like I said before, just like I don't know how to put this, but ask about things. I'll just skip that. That's about all I have to say, is to keep your head up and always surround yourself with good friends, and everything will be okay.
Here's Julie Hatch.
Sorry, you guys have to listen to me again. I really appreciate everybody coming to talk. Cameron, that takes a lot of guts for a high school kid to get up here and talk in front of everybody. And one of the things that I do want to address is Cameron's parents, who actually are sitting in the audience tonight, and good friends with them. And one of the things that they do is they do provide a chemical-free home for kids to come over and hang out, and I can't even imagine the amount of money they spend in food. But they really, they're doing a lot of the right things that parents need to do. They're asking what Cam's doing, where he's going, who he's going to be with. They're in communication with other parents as well, so those parents know that when their kids go over to their house, they know what's going on. They know that they don't allow that type of thing to happen in their home, and so I think that's one of the reasons why, you know, Cam's such a great kid, and he does an awful lot for the Chemical Health Initiative, and it really is a lot because of his upbringing and his parents and the things that they're doing. And so if only we had more of those parents around who do the communicating and really setting those rules and those goals for their kids, that we can really go a long way with the parents in our community. So other things that, you know, we want to talk about as far as the different community resources, and then the initiatives that we're also doing here as well. I'm just going to touch on these real quick. Like, we do have an awful lot that's going on in the schools. We've developed what are called chemical health assessment teams within each one of our school districts. And we really take a look at the different policies and procedures that we have lined up. We train the teaching staff in regard to how can they recognize youth substance use amongst their students within the classroom. We just have a lot of different opportunities to provide education for the students, the staff, and the parents. We've implemented the medication disposal program that Chief Pullman talked about earlier. We've also implemented social host ordinances and mandatory alcohol seller server ordinances. That's almost county-wide. To give you a little bit of an idea here as far as the social host ordinance, the 2 areas in red are the only areas within Goodhue County that do not have the social host ordinance in those communities yet. These are in progress right now, and so we'll certainly do that, but anywhere within Goodhue County, anybody, if they provide a place, knowingly provide a place for youth to hold parties, they can be held liable for that. In Goodhue County here as well, the mandatory alcohol seller server training ordinance. Again, those 2 areas in red are the only areas that we have within Goodhue County that are not covered with that particular ordinance. We have a drug paraphernalia ordinance here in Red Wing, and the only reason why it's here in Red Wing is because these types of products are only sold in smoke shops, and Red Wing's the only place within Goodhue County that does have a smoke shop, and so we do have that ordinance. The CHI, we actually have a display. It's called Hidden in Plain Sight, and if you haven't had a chance to take a look at it, we do have it set up out in the hallway there. And what we do is I actually go and purchase drug paraphernalia. I don't know if that's a perk or not of the job, but it's definitely interesting. And I went out to purchase it one day, and I thought, gosh darn, I got to drive all the way down to Rochester or somewhere else because you can't purchase it here in Goodhue County. But I do encourage you to stop by and take a look, because I think you would be surprised at the different types of drug paraphernalia that are hidden in plain sight, because they really look like just normal everyday items that kids would have in their possession. Parent education, we do an awful lot. Again, this is the in plain sight that we were talking about. We do implement a parent education program called the Power of Parents. That's a MAD program. And then we also had the Talk They Hear You campaign, where it really encourages parents to talk to their kids. We actually implemented this last fall. Hopefully you're going to be seeing a lot of these within the community. We're going to be focusing on the Those Who Host campaign that will be implemented right before the prom time, and then we'll continue that just into the summer. And this, again, just encourages individuals not to allow their kids to hold parties at their home. We have our SAD groups, and they really do a good job as far as they themselves going in and educating our younger people within their school districts. We have a plethora of websites. We've got 3 of them. We're also on Facebook and on Twitter. Still trying to catch on to the whole Twitter thing. I think the kids probably do that a lot more, but I don't know, us adults just don't do it as much. So anyway, as we're talking about the different initiatives and the different resources that are available here in town, we certainly want to focus on our newest resources that we do that has come to Goodhue County, and that is the Hiawatha Valley Mental Health Services. And we have Julie Hansen here, who's the executive director, and we just want to have her highlight what it is that they offer now, because they're now contracted through Goodhue County Mental Health Department, or the Health and Human Services, and because they're so new, their doors just open April 1st. We want to make sure that you're learning and hearing a little bit more about what it is that they have to offer for our citizens, our residents here in Goodhue County.
Thank you, Julie. I'm really appreciative of being here, and thank you all for coming, as other speakers have mentioned. I'll just give you a brief update of our agency. I am the executive director, and Hiawatha Valley has been serving counties of Winona, Wabasha, Houston since 1965. We recently expanded into Fillmore County and then most recently Goodhue County. So when the Goodhue County Mental Health Center chose to close at the direction of the county board, there was a process that was conducted in 2013, and so we prepared a proposal, submitted it, and were lucky enough to be asked to take over services in a private way. So as Julie said, we opened our doors on April 1st, and we are in the Merchants Bank building on Highway 61 on the first floor right across from the bank. So currently, we're continuing with the services that the Goodhue County Mental Health Center provided. So we're kind of small scale right now. We've got an adult psychiatrist. We have outpatient therapists who do mental health assessment and therapy for adolescents through adults. Hoping to expand that. We do some psychological testing and some in-home counseling. So as we build our team, what I intend to do or plan to do starting in late summer, early fall, is to add some adolescent psychiatric services, which I don't think currently are offered in Goodhue County. And then I will get licensed to do an outpatient substance abuse treatment program. So we would be able to provide drug and alcohol testing and treatment for adolescents through adults in our Red Wing office on Highway 61 there. So hoping to do some extensive outpatient and then some aftercare, because we've learned that at times some of our consumers will go through treatment and do very well and then may relapse, and then they come back to us as clients. And sometimes it takes 2 or 3 times for that cycle to happen, as you heard earlier. But ours will be an outpatient program. And again, it'll be for adolescents through adults. I also hope to do some schooling to mental health services, possibly for the Red Wing School District in the future. That might be starting this fall, but there's some planning that has to happen around that. So there are some materials out on the table. There are cards with our address and website, and we'll be sure to keep our new services as they launch, updated on the website. So please do check that out from time to time. And we'll try to do some media and marketing kinds of things to inform the Red Wing community what we're up to. The goal will be to expand into other communities in Goodhue County. We're not quite sure how long that'll take. We're kind of taking it one office or Red Wing one at a time and see how that goes. So that's kind of Hiawatha Valley very briefly. So again, thank you for letting me come, and have a good evening.
Thanks. Community action. Chris Blaney, parent volunteer with the Red Wing Chemical Health Initiative Community Council, will wrap up our presentation tonight by addressing parents and other adults in the community. She'll talk about talking with your kids, things to look for, talking with other parents, and how to get involved in your community. Let's welcome Chris Blaney.
Thank you, Tom, for that beautiful introduction. I won't talk too long because I know everybody wants to get outside, including me. But as I was sitting last night, going through and writing up my speech, and I had this nice speech all planned out. As I'm sitting here listening to these other candidates or these other individuals talk, I realized that a lot of the things that I was going to talk about, they have already addressed. Cam did a great job on talking about talking with your children, and I can't express that enough. about having that conversation. I actually had a proud moment with my 13-year-old about 3 or 4 weeks ago where he had a health assignment that came home, and there were talking points in there about talking about drugs, talking about smoking, talking about alcohol, and we're sitting at the dinner table going through this assignment and having this open conversation about what to do, how to handle different situations, how does he feel? And it was a great conversation to have with the 13-year-old because that is the moment, one of the moments that truly impacts them for the rest of their life. And how parenting, there's no exact science to it. There's no handbook. It's, we do the best that we can with what we have to work with. And communicating and having those open conversations and setting those expectations for your child on what you expect out of them for tobacco use, alcohol use, drug use, is so important, and to set those consequences for them when they violate that expectation. One of the things that came out of the conversation was we asked him, how do you think we handle ourselves when we're out having a drink or at a party? And he goes, well, you guys are very responsible. He said, you guys set a designated driver. And it was great to hear that from a 13-year-old that actually recognized that his parents were being responsible. So we hope that that will set that trend in motion, that when he gets to a situation where he has to think about it or gets into a situation that he will think about it and make that right decision. And that's all we can hope for as parents, is to give them that information, give them that education piece, and to help them make them right decisions. One of the other things, that kids and teenagers need to think about is the impact that an illegal consumption will have not only on their family, but on their driver's record. That could potentially cost them a job, if that's stuck on their record. Financially, it costs parents money, which in turn could cost them money. The insurance ramifications of it, if you're thinking about hosting a party, call your insurance company and ask them what they think about it. Guarantee they're not going to be very happy about it. One of the things that you can do at home is lock your liquor cabinet. It seems kind of a simple thing, but you may trust your kid, but do you trust their friends that come over to their house? One of the things to think about as well. One of the things that we do at home is we tell our kids, you be straight with us, we're straight with you. And that way it's laid out all on the table. When you talk about getting involved, get involved in the community. Get involved with what your kid's doing. Kids are, they talk. They talk. And if you're out there in the community and you hear some of that talk, that helps you. And so, get involved in programs. Get your kids involved in programs, whether it's athletics, whether it's academics, whether it's an outdoor program, the YMCA. Get them involved, because that is where they're going to build their friend structure. And the better friends that they have, the less likely they are to use. I don't know if I need to touch on anything more. I think everybody else kind of, Cam did a great job and Gina did a great job about how to talk to your kids. And I think communicating is where you start, and there's no time to not start. It's start as soon as you can, talk as often as you can, give them that safe zone that they can come and talk to you, and that if they have a situation, they feel that they can trust you to help them handle the situation. Don't handle it for them, help them figure it out and help them handle it on their own. So I want to thank everybody for coming tonight. I know it was a beautiful night. Maybe if it was a rainy day, we'd have more people, but hopefully we can have another one of these and bring some more information to the table the next time. Thank you.
Thanks, Chris. Thanks to Chris and all the presenters for the information provided this evening. We'll now open it up to the audience for any questions you might have for any of the presenters. Anybody have any questions? Have we got any answers? We've heard all the answers, right? Well, thanks for coming out tonight. I hope you consider taking part in creating a safe and healthy community for kids. We also want to direct you to the tables outside the auditorium provided for you from local organizations, and have a wonderful resource for you there, and have a great night. Thanks again for coming. See ya.